Pensioner Vicky McCaig can now brush her teeth without pain. For 2 years, the 71-year-old grandmother couldn't afford to see a dentist.
You never have that much money to play around with, so my teeth wasn't a priority. I was getting lots of pain, lots of sensitivity in my gums and bleeding.
Luckily, Vicky was accepted into a trial of a seniors' dental benefits scheme. Her teeth were fixed for free and she avoided a trip to hospital.
Extremely lucky, very lucky. I mean, how many times is something like this offered? When you're experiencing pain every time you put something to your mouth, it gets you down after a while. You know, you can't enjoy your food, can't enjoy your drink, and your life does get challenging, very challenging.
That's looking very good around there.
The Australian Dental Association is calling on the government to introduce a seniors' dental benefits scheme.
Anybody on a healthcare card or pension card that's over 65 years old is able to access a government-funded scheme similar to the child dental scheme that's running at the moment. That would unlock access to private practice clinics and government clinics across Australia. And we know there's a significant number of those people that can't currently afford access to care.
About 16,000 over 65s are hospitalised each year for dental treatment, and that's predicted to rise to almost 23,000 by 2028. It's hoped a seniors' dental benefits scheme would reduce those admissions, giving eligible seniors $1,100 of free dental work every 2 years.
There's a whole bunch of bodies calling for action in this space, and it's falling on deaf ears. It's rather frustrating.
The idea of a seniors' dental benefit scheme isn't new. It was recommended by the Aged Care Royal Commission. But years later, and with the cost of living rising, there's still been no commitment. The Federal Health Minister says there's no plans to change the way dental's funded anytime soon.
It's desperate, and it's been desperate for decades. And I suppose the disappointing thing is that the doctors and the nurses, who are they're angels. People who work in aged care facilities are trying their best, but they don't have the knowledge or the skills to make oral health decisions.
Dental photos of nursing home patients graphically demonstrate the problem.
There are multiple factors as to why people don't access dental services. Cost is certainly a major one. And yes, I am seeing years of neglect prior to people entering aged care facilities. And the sad thing is nearly all of it can be prevented.
Avoiding pain and poor health. Elise Worthington, ABC News.